On January 28, 2025, a technical glitch in the U.S. Department of Health and Human Services payment system sent shockwaves across the nation. This outage, impacting the Payment Management Services portal, has frozen the flow of federal funds to vital programs like Medicaid, Head Start, and community health centers. These programs, serving millions of Americans, now face an uncertain future, their ability to provide essential services hanging in the balance. The situation has raised serious concerns about the vulnerability of these programs and the potential consequences for those who rely on them. Medicaid, a lifeline for low-income families and individuals, is facing severe disruptions. Millions of Americans depend on Medicaid for healthcare access, and this outage threatens to disrupt their care. Head Start, a program crucial for early childhood education, is also grappling with the fallout. The program's ability to serve children and families is now in jeopardy. Community health centers, often the only source of healthcare for underserved communities, are feeling the pressure as well. The funding freeze has created a ripple effect, impacting healthcare providers and patients alike. Healthcare providers are now faced with agonizing decisions, unsure if they can make payroll or keep their doors open. Patients, already struggling with healthcare access, face the possibility of losing their lifeline. The situation is dire, demanding immediate attention and action. The White House, facing mounting pressure, has acknowledged the outage but maintains that it's a purely technical issue. Press Secretary Caroline Leavitt has assured the public that payments are being processed and the issue is being addressed. However, this explanation has done little to quell the anxieties of those on the ground. The timing of the outage, coinciding with the Trump administration's recent move to freeze spending on certain federal grants, has fueled speculation and skepticism. Critics argue that the outage is a direct result of the spending freeze, a claim the White House vehemently denies. This back and forth has further muddied the waters, creating confusion and mistrust. Adding to the uncertainty is the HHS's announcement of a review of its programs, citing executive orders on abortion funding. This review, expected to cause delays and rejections in grant payments, has further heightened concerns. The lack of clarity and transparency from the administration has only amplified the sense of unease and distrust. The situation remains fluid, with no clear end in sight, leaving millions of Americans in a state of limbo. Senators and advocacy groups have wasted no time in voicing their concerns about the outage and its potential impact on vulnerable populations. Senators Ron Wyden and Brian Schatz have been particularly vocal, criticizing the administration's handling of the situation. They argue that the outage, whether intentional or not, is a direct consequence of the administration's policies and rhetoric. Their concerns are echoed by advocacy groups like the National Association of Medicaid Directors and the Georgetown University Center for Children and Families. These groups, on the front lines of providing services to those in need, are witnessing firsthand the chaos and anxiety caused by the funding freeze. They warn of dire consequences if the issue is not addressed promptly and effectively. The National Association of Community Health Centers paints a bleak picture of the situation on the ground. They report that health centers are struggling to meet payroll, forcing them to make difficult decisions about staffing and services. The situation, they warn, could lead to closures, leaving vulnerable communities without access to vital healthcare services. Healthcare providers, already grappling with the challenges of a complex and often overwhelming healthcare system, are now facing an unprecedented crisis. The funding freeze has thrown their world into disarray, forcing them to confront the very real possibility of having to cut back services or even shut down altogether. Amanda Pears-Kelly, CEO of Advocates for Community Health, warns that the delays in funding could have a devastating impact on health centers and the communities they serve. The uncertainty surrounding the situation is taking its toll on healthcare providers, who are already stretched thin. Many are struggling to explain the situation to their patients, who are understandably anxious and confused. The emotional toll on both providers and patients is immeasurable, adding another layer to an already complex and stressful situation. If the funding freeze continues, the consequences could be catastrophic. Healthcare providers may be forced to turn away patients, reduce staff, or even close their doors. This would leave millions of Americans without access to essential healthcare services, exacerbating existing health disparities and creating a public health crisis. The situation is dire and the need for a solution is urgent.